Welcome to the Washington Post special report on the coronavirus COVID-19. I'm Libby Casey, and I'm joining you from my home in Washington, D.C. Thank you so much for taking the time today. Here's the latest news we're tracking. President Trump has removed the inspector general who was to oversee the $2 trillion in stimulus relief spending. That's the latest move by the president to push back against oversight. New York State has hit its highest death toll for one day, 731 deaths. But New York Governor Cuomo did point out that a 3-day average of hospitalizations has trended downward. So that's one encouraging sign. And here's another one, potentially. The Trump administration has revised its estimate on the number of expected deaths and hospitalizations. A model they're watching to track the pandemic is now predicting there may be fewer deaths expected. Of course, we're still talking about tens of thousands anticipated. Now, there are a lot of questions about just how the United States got to this moment, where healthcare workers are pleading for proper safety equipment and governors are bargaining over ventilators. And my guests today are going to track for us what happened over the past couple of months. So I'd like to welcome Greg Miller, national security correspondent, and Yasmin Abutaleb, health policy reporter. Thanks so much to both of you for being with us today. Greg and Yasmin co-authored a story with Josh Dawsey and Ellen Nakashima, a piece that chronicles just what happened in those valuable early months when the White House had the opportunity to prepare and react to the coronavirus and did not. And it details 70 days from that notification in early January to when the president started acting and talking like the virus is actually dangerous. So, Greg, I want to start with you. Why is it important to look backwards and track this? Because, of course, we're so focused on the now and the future. Why look back?
I mean, it's a good question. I think that, I think that it's important. Our mission as a news organization is to try to help the public understand how its government is functioning. And this kind of accountability journalism is really core to what we do at the Washington Post. We try to look in a very careful way at how various institutions have handled this crisis, and up to and including, of course, President Trump himself. And I think it's. I'm sure we've all heard from readers, isn't it? Sometimes we get reaction, isn't it a bit early to be looking at this? But I mean, I think that we're deep enough into this crisis now to have a pretty clear sense, or at least a preliminary one, of what transpired over this 2-month period that kind of helps us understand why the United States is in such a seemingly vulnerable position right now. And did it have to be this way? And inevitably, we're going to have more stories going forward looking at the handling of this crisis. But this was our first major substantial attempt to do that.
Yasmin, let's go back to the beginning. When did officials learn about what was happening in Wuhan, China? And how was it initially interpreted?
So the CDC got its first notification on December 31st, and then by January 1st was starting to prepare briefing materials for the Department of Health and Human Services. By January 3rd, they got a really unambiguous warning about what was going on. The Chinese CDC director called the American CDC director, Robert Redfield, and told him, this mysterious flu-like illness that had never been seen before was starting to spread around China. And so the CDC director told Alex Azar, who's the Secretary of Health and Human Services, who then wanted the White House National Security Council to know. So we know that the White House got its first formal notification on January 3rd.
So tell us about Secretary Azar. We're all seeing him maybe a little bit less right now because President Trump is always at these briefings, but he was for a little while a face we were all seeing and associating with the attempt to deal with and combat the virus. So what was his experience and background before this moment, and did he take that threat seriously?
Our reporting indicates that he did take the threat seriously. One of the things that we came across time and time again in the reporting is that President Trump doesn't like bad news, whether it's factual, and it doesn't really matter who it's coming from. So there did seem to be some pressure for officials to try to relay the threat to him and to tell him that this was going on. But it's a bit unclear just how much they stressed how serious it was or how quickly it could spread out of control, or whether the president simply didn't want to hear that for a while. Secretary Azar was in the Bush administration as the general counsel of Health and Human Services. He was involved in efforts to write a sort of playbook on pandemic preparedness. He had been there for 9/11, for anthrax, for the 2005 bird flu. So he's been through these types of outbreaks more than once or twice.
So you guys write that there was initially a promising response, that there were early conversations about things like the Defense Production Act and figuring out how to track cases. So Greg, what were some of the early moments for potential, breakthrough and getting on, I want to say getting on top of it, because a pandemic is so, as you guys explain and report, is sort of so unwieldy. But what were some opportunities or moments where they could have at least been able to, focus on this and alert other agencies and other actors about how serious this could be?
Yeah, I think that, that's one of the critical things we tried to do in the story. And there are examples that go in both directions of officials inside the administration and at these important agencies who recognize the danger here, and we're trying to mobilize, we're trying to react. And then there are other officials who look like they were less concerned about this, and that there was tension, and that often accounted for the dysfunction that we describe in the story that set back the United States response. But there were critical opportunities. There were, we say in the story that the decision to close down or restrict travel, incoming travel from China, was an important early step. Almost simultaneous with that, the Deputy National Security Advisor, Matt Pottinger, was already saying that, urging that other incoming travel be restricted from Europe and elsewhere. And of course, that eventually happened, but it only like 7 or 8 weeks later. And so a lot of passengers, presumably a lot of infected passengers, had come into the United States during that interim period. And there were other factors that constrained officials. The inability to get samples of the virus from China very early on proved to be an important kind of setback. But a lot of what happened was self-inflicted. And through Yasmin's reporting and others, we learned a lot in this story about the CDC's real failure to develop a test, a functioning test. Understanding the spread of a virus like this requires an ability to diagnose individuals who have that virus. And the United States was not able to do that until it was much too late, in part because it relied exclusively on the CDC to come up with that capability. And they kind of screwed up. They developed a test that didn't work. And so it was kind of back to square one when there was a chance to really mobilize and get out in front of this.
Yasmin, how much of a game changer could it really have been to have an effective test and an effective testing strategy?
I think it would have changed the sort of outlook that we're seeing now quite a bit. One thing that we note in the story is the CDC is not a large-scale manufacturer. The CDC alone was never going to produce enough tests to process thousands of tests a day and to test Americans on a wide scale. That's not their job. So, like Greg noted, the CDC's inability to develop a properly functioning test early on was a huge hindrance. But I think one of the lessons learned is, for coronavirus, which turned out to be a pandemic, and to be fair, you couldn't have predicted that necessarily in January. You needed to engage commercial industry, private industry much sooner. They have the capability to process thousands of tests a day. The CDC alone was never going to produce enough tests for something of this scale. So if you had developed a sort of broader testing strategy earlier on, say by early to mid-February, you could have identified some of these hotspots a little bit earlier. By the time Seattle started having some cases of community spread, a study concluded that it had probably been spreading in the city for about 6 weeks already. So by the time we started detecting these outbreaks, it had been spreading sort of unnoticed for weeks. So if and you can see it in other countries that had a sort of broader national testing strategy. South Korea was able to bring its outbreak under control much, much faster than the US because they did large scale testing, they had drive-through testing, and just identified and isolated cases really early.
So let's talk a little bit more about some of these missed opportunities to sort of get the president's attention and get him focused on this issue and other top White House staffers. So you guys explain in detail Secretary Azar sort of trying to reach out to President Trump. Yasmin, can you give us one of the examples of a time when he was trying to get through to the president and just told associates that he just was not able to?
Yeah, I mean, I think the first time he tried to sort of seriously brief the president about this, that was certainly the case. He called the president on January 18th to, give him a formal briefing on what was happening. The administration was starting to talk about, whether they'd need to repatriate some of the Americans in China if they were at risk. So Secretary Azar calls President Trump while he's at Mar-a-Lago that weekend and, gets through to the president. And before he can even say anything, the president starts badgering him about a fumbled vaping policy. In the fall, Azar had encouraged the president to ban flavored vaping because of the rise of teenagers using it. It ended up being this whole political problem. And he just immediately sort of tore into him on that. And then when the president finished his, sort of badgering of him, Secretary Azar tried to say, there's this outbreak that's happening in China. We're taking it seriously. We're all mobilizing. We're working on it, trying to assure him that his administration had it under control, but that they were taking it seriously. The president seemed pretty disinterested in that whole briefing. And so, we also found out that Azar had called the confidant saying, I don't know how to break through to the president, or it's not getting through to him. How can I break through? Do you have any tips or suggestions? I think tried to carry out some of those tips, but it doesn't look like to any avail.
Greg, we have some viewers and readers who've written in questions for us. And here's one for you from Alfred, who writes in from Washington State. What did the CIA and the National Security Council know about the coronavirus outbreak in Wuhan? And Alfred's asking specifically back as early as December or January. And he wants to know what actions were taken in response. So can you give us a sense of when and how this gets on the radar of those agencies that are not just thinking about the health of Americans, but the security of our country?
Sure. Yeah. So I think one of the things we report in our story that had not been previously reported was that the outbreak in China was mentioned in the president's daily brief in the early part of January. The president's daily brief, or often called the PDB, is a really important document. That is what the U.S. intelligence community uses to put stuff in front of the president of the United States that they think he needs to really be focused on and worried about. And it's the most prestigious document that the intelligence community puts together, and it's exclusively for the president. And so from that point forward, the coronavirus and the outbreak was being mentioned in the PDB repeatedly over a multi-month period. And so that's a really important effort to try to call the president's attention to what was happening. Now, early on, I think that those reports were largely sort of focused on the fact that, look, it looks like there's an outbreak in China of something significant. It looks like the Chinese are suppressing information about this. We don't have all the details. This is not, in early January. There's no evidence that the CIA or other agencies were saying, look, there is a global pandemic on the way. I do think those warnings started to come later, but in the early stages, it was focused on China. Something is happening in China, Mr. President, and you need to know about it.
Greg, there's the information flow, and there's getting the attention of sort of the right actors within the White House structure. Then there's also, though, a tension that develops between those members of the president's team who are concerned about the economy and those members who are concerned about a potential health crisis in the United States. So what is that struggle like, and how does it end up impacting the United States efforts?
I mean, there's multiple kinds of tension that come into play here. Yasmin was just talking about that early attempt by Azar to get through to Trump in his conversation on January 18th. And one of the things we said in our story was that Trump thought that Azar was being alarmist. And I think that's something that these health professionals are accused of a lot. That is part of their job. They are there to be alarmist, to think in kind of worst case scenarios. They are projecting what's the worst that can happen, because you have to start mobilizing while you're still contemplating something that's a distant danger if you're going to have any chance of containing it by the time it gets here. And so Trump's kind of reaction that Azar seemed alarmist is telling of one kind of friction, right? Politicians, presidents, and others, they don't see the world that way. They're worried about much more temporal things and much more immediate things. But another really important source of tension in this story was the concern about the economy. And that comes straight down from the president himself, right? And he often seems almost fixated on the stock market. He's taken credit over and over again for the jobs creation, for the rise of the stock market during his presidency. And there were key figures in his administration, including Mulvaney, Mnuchin, and others, who, when they were getting these warnings from healthcare executives and officials, health officials, they're pushing back against it. There's too much downside for our economy if we move too quickly, for example, to curtail flights incoming from Europe. The economic damage is too great. The risk is too high, not worth doing. And the health people lost those early battles to the money people, is basically the way to look at this.
Yasmin, we've talked about testing and missed opportunities to develop a robust and organized testing system here within the United States. But let's talk about hospital gear and protective equipment, basic protective equipment like masks and gloves and covers for the physicians and the hospital workers who are dealing with patients. Azar, as you point out, had a background. He dealt with sort of the strategizing and preparing for epidemics or outbreaks in the past. So where was the conversation about making sure the United States had enough protective gear for its medical force?
So you saw that manifest itself in fights over a supplemental to send to Congress, more money for combating the virus. So HHS and Azar start raising the need for a supplemental towards the end of January, early February, saying, we're quickly draining this congressional fund of about $105 million. We're going to need more than this. And at that point, there's only a few US cases. They're pretty much all linked to travel, people who have been repatriated to Wuhan. So the public is still not seeing this as that big a deal. Many members of the White House and the administration are not seeing it as that big a deal. So initially they say there is no need for more money. There's enough right now. And then when they start getting to talking about a supplemental, Azar and HHS sent in a request for more than $4 billion. Part of that money would be used to buy protective equipment. The other problem here is that HHS is responsible for managing a strategic national stockpile of N95 masks, ventilators, protective equipment. That stockpile had been chronically underfunded, did not have enough equipment for a pandemic, which is sort of what it's supposed to be there for. So it was a combination of that, plus, wanting to start buying equipment, much of which was manufactured in China, before they were competing against a bunch of other countries that were going to have to deal with their own major outbreaks. But there were fights over the supplemental. Azar sends in the more than $4 billion request. It's initially rejected and viewed as alarmist, given that there aren't that many US cases. They eventually land on a $2.5 billion figure that Congress, berates them taking this seriously. But that took until, the first week of March. I think what health experts and officials sort of realized, and some national security experts realized, is you needed that money back in early February. One, it would have signaled to hospitals and to states, people on the front lines, how serious this was and how seriously the administration was taking it, so they could make their own preparations. And two, it would have given the US several more weeks to buy up this equipment. Now they're putting in orders, but some of it is delayed until the fall. There isn't enough equipment in the stockpile to give states what they need. Now states feel like they're competing against each other and trying to sort of get President Trump's ear to convince them to send very limited equipment to them as opposed to some other hard hit state.
Let's talk about President Trump's words and how he talked about the virus and how he was talking about it both in Washington as well as on the campaign trail. You point out that in February 10th, President Trump was having a rally in New Hampshire. I remember that well because I was in New Hampshire and we were all sort of in this very different world watching the political race, unfold, the presidential race. But President Trump was talking about coronavirus and he was talking about it. And he said, by April, in theory, when it gets a little warmer, it'll just miraculously go away. So really telling the American public not to worry about this. Greg, what was happening along that same timeline in that early February to mid-February timeframe behind the scenes?
I think that's a really critical period. We know that by that point, officials on the NSC had already talked about expanding the ban on incoming travel. There were sort of rushed efforts to get testing moving forward at that point. And there were initial efforts to, mobilize the task force that was going to lead the response to this. And this is just sort of a part of a broader pattern of Trump sort of dismissing experts and expertise and undercutting them and undercutting their message. And in this case, in a really critical way. We say in the story that it may ultimately be impossible to ever accurately figure out how many infections, how many deaths might have been prevented with a different focus and an earlier focus. But even when you have health executives and officials really racing and trying to do their jobs and mobilizing, it's nearly impossible to get a whole of government effort in response to an adversary like this when the president isn't on board, when the president is sniping about it or raising skepticism about it. We saw this actually with the Russian interference in the election. It was dismissed by the president before and after the election. And it's hard for those government agencies who are responsible for protecting the rest of us to do their jobs and to get the public's attention when they are going against a headwind coming out of the White House like this.
March 9th, March 10th, we've jumped a whole month ahead of that February timeline we were talking about. The president was tweeting and saying that the virus was like the flu, that things shouldn't shut down. And he said the virus would go away and people should just stay calm. So Yasmin, what was happening behind the scenes in that time frame when we're talking about early to mid-March?
I think at that point, it was extremely clear that this was a serious problem that was starting to spiral out of control in the US. You had several outbreaks happening at that point. Seattle was a hotspot. Santa Clara, sort of San Francisco Bay Area, the governors of New York and California were imposing lockdown orders, and officials were projecting, what the next hotspots were going to be. Miami, New Orleans, Detroit, Chicago. It didn't seem like any part of the country was going to be spared at that point. And you already had tens of thousands of cases. So at that point, it's extremely clear that it's going to be a widespread outbreak. You have hospitals starting to, and healthcare workers sounding the alarm about the fact that they don't have masks, or they have to wash and reuse masks that are supposed to be disposable. They're testing patients without proper protective equipment and being exposed every day, and then potentially exposing their families. At that point, most of us had begun or were about to start working from home. At that point, the country was already, and the market was spiraling, and Italy was out of control, and Spain was starting to move in the same direction. It seemed pretty clear the US was going to be the next epicenter of the outbreak. Everyone kept saying the US is only 2 weeks behind Italy, which at that point was in dire straits. So March 9th, March 10th, it's very clear that this is not the flu, that this is something much more serious than seasonal flu. And the other thing to keep in mind is part of why this is so serious is because we don't have a treatment or vaccine the way you do for a seasonal flu strain.
Yasmin, we have a question from Kathy who wrote in from Avon, New York, who wants someone really to ask President Trump when hospitals will have needed equipment. And she wants to know what information is leading the president to think that anyone can be tested. So Yasmeen, I watched the president's briefing just yesterday. He's giving a reassuring message. He's talking about adequate supplies and materials, but we're not hearing that same thing from a variety of governors, but also from healthcare workers who are on the front lines themselves.
Well, you've seen the president put a lot of the responsibility onto the states for equipment, and basically said it's not the federal government's job. There are certain states that have gotten some help from the government. They're sending supplies as needed, but you've also seen the president sort of dismissing the pleas of certain governors by saying it's a state problem, the states need to be prepared, or the states aren't handling it well. On what leads him to think anyone can get tested, I honestly think that's anyone's guess. It may be he's seeing the increased number of tests that are being conducted, and that makes it look like anyone can get a test. But I think it's pretty clear from media coverage, from social media, that plenty of people who have symptoms are not going to get tests because they can't or they're scared to. And the official guidance has been, if you have mild symptoms, to just assume you have it and to not go get a test, because there aren't enough tests and there isn't enough protective equipment for the people who need to conduct them. So that's just, that guidance changed a couple of weeks ago, which I think is the clearest signal that there clearly aren't enough tests and there clearly isn't enough equipment.
I'd like to welcome Dan Baltz to the conversation, Chief Correspondent. Dan, thank you for joining us.
Thank you.
Dan, while we've still got Greg and Yasmeen here, I want to hear from you on this question of leadership and a consistency of tone and a consistency of message. And I know you've been talking to people about sort of past crises endured by American government, 9/11, the financial crisis of 2008, Hurricane Katrina. What is it about messaging and having sort of a clear message from the commander-in-chief or from people who work for him that can make a difference or can help clarify what's happening, Dan?
Well, it's absolutely essential in a moment like this, and we've seen this from various other disasters that we've gone through, crises that we've gone through, and it goes in two different directions. One is you need clear and consistent messaging starting with the president, and first and foremost from the president to the American people. That is something that we've not seen, obviously, in this case. But it's essential so that people understand the nature of what they are dealing with, and to give them confidence that the government has the capability and some kind of a plan, even if it's an improvised plan, for how to go forward on it. So that's one thing. I think the second aspect of this is that you need that at the top of government for the rest of government to be able to work as efficiently as possible. I think, we all understand human nature. We all understand the nature of bureaucracies. We all understand that when you are asked to deal with something for which there is no particular precedent, it is hard. But the government has a lot of capability and a lot of expertise spread in a lot of different places. And if you are not able to, in a sense, command that effectively, then you diminish the ability of government to respond. And in doing that, you diminish the confidence that the public has that the federal government knows what it's doing.
Yasmeen, is there a unified voice now coming from the White House? I mean, we're all watching Dr. Fauci, Dr. Birx to sort of see what role they're playing, if their message is consistent with President Trump's. Whenever Dr. Fauci says something like he thinks, all states should have sort of a more uniform position about social distancing and having people stay home, then we see him at the briefing and he's sort of, not aggressively keeping to a message that he might have told a reporter or might have said in a prior interview. So is the messaging unified, and who's leading it?
I think it depends on the day, but generally the messaging is not unified. And it sort of ranges in every critical aspect of the response, whether it's the effectiveness of, a potential drug for coronavirus. It's pretty clear the administration is all over the map on the effectiveness of hydroxychloroquine, which Trump sort of wants to be this magic bullet. Fauci's urging to wait for the clinical trials. And then you have, trade advisor Peter Navarro saying, no, it's great, and sort of pushing it. On the social distancing measures, you had Trump one day saying, we're going to open the country up back by Easter. And then a couple of days later saying, actually, we're going to extend it for another 30 days. A couple of days after that, giving really grim projections, then sort of whipsawing back to wanting to reopen things. So the messaging honestly sort of depends on the day. And right now the administration has said, it's 30 days to stop the spread, which would take us to the end of April. Every health expert agrees that is not enough time, that the peak of US cases may not come by that point. And you need to be on sort of a downward trend before you start slowly reopening things. And there needs to be a strategy for who goes back to work and when. We haven't really seen any of that yet, or any indication of a strategy for how that's going to work. So I think right now it's still pretty unclear where various members of the administration stand on reopening the country, how serious things are right now, and when things can slowly start to be going back to normal.
Greg Martin wrote in from St. Petersburg, Florida, and asks this. He says, the president, White House were well informed about COVID-19 back in January. So why aren't they being held accountable, perhaps even legally, for the deaths that happened before the White House took significant action in March?
Well, I mean, I think it's that's typically sort of politically there are reasons that is not happening here, including that the president's party controls the Senate, and I think that there will be efforts to hold not only hold people accountable, but to study and try to understand what happened when we emerge from all of this. I mean, there are already calls for something along the lines of a 9/11 commission to investigate how this happened in the United States, which, this goes back to what Dan is looking at in his reporting, and our tendency as a country to have this, to be stuck in this kind of rut where you have crises that are not anticipated, that are not prevented, but where there is some significant warning in advance of them, and why that happens over and over again for us as a country and as a nation, and why then we end up with these lengthy, very detailed studies of what went wrong that often are backward looking and fail to prepare us for what comes next. If I could just touch on something that Dan and Yasmin were also describing a minute ago. You were asking, Dan, about the importance of a president's voice in a time of crisis like this. And I think in this case, you have an additional layer that makes it hard for the public to get accurate and trustworthy information. And that's something you touched on, Libby, which is that the officials surrounding Trump are constantly seeming to be making this mental calculation. How can I say what I think needs to be said to the public here without drawing the ire of the president and potentially being deprived of my ability to send that message going forward? If I go too far in contradicting the president, undercutting him or correcting him, am I not going to be here invited back to this press conference, or maybe am I not even going to have my job the next day? This is a really difficult environment for people who are in the middle of a crisis, trying to protect and save thousands of lives.
Greg, I want to ask you about one thing that goes to this question of accountability. The president has removed the inspector general who was supposed to oversee that $2 trillion stimulus relief package. So we're seeing that replacement happen. You were tweeting just a little while ago and noting the various people who have been replaced or removed, even just during this coronavirus period alone. What's the pattern here?
I mean, so we've had, the officials who've been removed from their jobs just in the past several days in the midst of the corona crisis for various reasons are the captain of a ship that was infected with the virus, the inspector general of the intelligence community, and now the inspector general who was going to oversee the spending of billions of dollars in this emergency aid that's splashing around that's just beginning to splash around the country. I mean, you have to look at these developments and conclude, I think, that this is a president who doesn't like to be second guessed or to have much accountability, does not like to have people, independent voices, be in position to scrutinize what his administration is doing. I mean, in the midst of the corona crisis, he has continued to lash out at the whistleblower over Ukraine. And so, I mean, this is this is a well-developed pattern for this president by now.
Craig Miller and Yasmin Abutaleb, thank you so much. We're going to say goodbye to both of you, and I look forward to continuing to read your reporting. Dan, stay with us. I'm so fascinated, Dan, as you dug into past crises that the United States has faced and this question of preparedness. And you confront the reality that you can never really be prepared for what you don't know is coming, right? So how did you think about preparedness and what that means for sort of a country as large, with so many states and so many different layers of bureaucracy as the United States? What does it mean to prepare for the unknown?
Well, I think what I learned from the reporting that I did for this particular piece is that government is never prepared for the truly unexpected. And even when there are some advance warnings, they're not prepared because they don't know what to do that's different than what they've been used to doing. Take the Pentagon, for example. The Pentagon has plan after plan after plan, as somebody said, I think it was Jay Johnson, the former DHS secretary who was general counsel at the Pentagon, said to me, he said, the Defense Department has an assistant secretary for everything, and they have a plan for everything. They are tasked with a culture of planning and preparation. But as somebody else said to me, yes, and I bet most of those plans are quite good at the things they know what to do already, but not particularly good at the things that they don't necessarily anticipate and don't know how to do. And I think that's one of the things I learned in this, which is that there are plans and there are plans, but plans meet reality and no plan survives that reality. And at that moment, then the question is, how effective is the government at dealing with the unknown? And what we've found time and again is that it is not particularly adept at it. Some of it has to do with leadership, and some of it, as I said, has to do with the nature of the policymaking process in a crisis. Phil Zelikow, who was the executive director of the 9/11 Commission and is now at the University of Virginia, has studied this a lot. One of the things he said to me was that what we have seen over a long period of time is a deterioration or a degradation of that kind of policymaking process in government. As he was talking about it, excuse me, we developed in the 30s and the 40s and the 50s a reputation as a nation that could do almost anything. Obviously, World War II was one example of that, but beyond that, I mean, the Marshall Plan, which was an enormously complex, it was more than just sending aid to Europe. It was a very complex plan for how to bring Europe back after the devastation of the war. The Berlin airlift in 1948, when the Soviets closed Berlin and the city was shut off from all essentials. And the United States improvised fairly quickly and then systematically an airlift that eventually brought the Soviets to, reopen the city. They were humiliated by what we had led. Phil says that kind of capability exists at a much less level than it used to in the past. And so that's one of the problems that we have. There is a kind of a systematic chronic weaknesses that we have in the way we prepare and then plan and then respond to these kinds of crises. I mean, I don't think you can blame everybody for everything. I mean, that things go wrong and people have to adapt. But we've seen a consistent pattern over a number of crises and a number of different kinds of crises. Now, as Greg said, some of these get fixed. I mean, we are much better at preventing terrorism today than we were prior to 9/11 because of changes that were made as a result of what happened in 9/11. We will be better at, we will have a bigger and fuller stockpile of important medical equipment as a result of what has happened here and the gaps we've seen in it. I suspect that state public health operations will be more robust than they have been up to now. But this is all looking backwards, and it doesn't necessarily say, okay, what do we do when the next one hits?
I want to talk to you about the history of pandemic preparations in the US, because this is just so fascinating. You report on how it was President George W. Bush who set a national pandemic strategy. And you report, Dan, that it wasn't because of something that happened, it was because of a book that he read.
Yeah, it's an interesting story, and it was told to me in passing, and then I did a little bit more reporting on it. Josh Bolten, who was the White House chief of staff in the latter part of the Bush administration, recalled that the president had asked for this after having read John Barry's book, the 1918 flu book called The Great Influenza. And Fran Townsend, who was Bush's White House Homeland Security person, said that what had happened was that he was down in Crawford, Texas in the summer of 2005. And it's not well known, but Bush was a voracious reader. He read a lot of books, and he and Karl Rove used to have competitions for the numbers of books they would read. One of the books he read while he was down in Crawford during the August break of 2005 was John Barry's book about the pandemic. Well, then we know what happened. At the end of his time in Crawford, Hurricane Katrina hit. And the first indication was, okay, they'd survived the hurricane all right. And then there was the storm surge and the levees breaking and all the terrible things and flooding that happened. And Bush got caught up in that and was highly criticized for some of the way the government responded to that, justifiably so. But sometime once the dust began to settle or the floods began to recede and the relief efforts were a little bit more efficient, at some point he called Fran Townsend into the Oval Office and he handed her John Barry's book. And he said, I want you to read this book. I want a national strategy on pandemics. And she said her first reaction was kind of harumph. You know, it's like, I've got real things to worry about here. Why do you want me to spend time reading this book? So she took the book and left the Oval Office and soon thereafter read the book. And she said, I understood instantly why he wanted to do this. I mean, it was very clear that there was a problem and that there could be a problem. And so she said she convened an interagency cabinet level meeting about this and presented the idea that the president wants a national pandemic strategy. And she said the reaction that she got from members of the cabinet and others was similar to her initial reaction, which was, we've got more important things to do. You know, we've got real problems on our plates. We are very busy. Why do we have to do this? She said she set up a program. They eventually got a strategy, and she set up a system of essentially scorecards and grading, you know, giving grades to agencies as to how well they had responded to put together the elements that were needed. So that was one of the origins. So there was a national pandemic strategy that was passed on to the Obama administration.
Yeah, and I want to point out that part of what was able to get, you know, Fran Townsend pushing forward was that the president, George W. Bush, was on board. So she had that sort of as a you know, something to present of like, this is something the president actually wants. So it gives credence to that message. And as you point out, they did a handoff to President Obama and gave a plan to President Obama. And then the Obama administration also handed off a plan to the Trump administration. I want to pause for a moment, though, and welcome Aaron Blake, who's one of our senior political reporters joining us. Hi, Aaron. Thanks for taking the time to talk with us. Dan, I want you to dig into this, though, because there's been so much of a question mark of like, what did the Trump administration do with what the Obama administration gave them? And you give us a better sense of how this handoff happens. And you recreate this scene for us where Lisa Monaco, who worked for the Obama administration, has one of these handoff meetings, you know, with the cabinet members of the Obama era and the people who are going to come in to the Trump administration. And she's trying to pass off this potential nightmare scenario of a virus with no vaccine. So what was Lisa Monaco thinking about in terms of the message she wanted to convey to these people brand new to running the country?
Well, this was a very interesting moment. The Obama team, and particularly President Obama, was very appreciative of the way President Bush had conducted the transition to the Obama administration. And he said to his people, I want to meet that mark. In fact, I would like to exceed what they did in terms of the cooperation and the information that they transferred. So one of the things that Lisa Monaco did, she was the Homeland Security person in the White House at that time, was to convene a meeting of the outgoing Obama cabinet and the incoming Trump cabinet, and to discuss a series of issues that, you know, fall under the rubric of national security or disaster preparedness. So they talked about terrorism, they talked about cybersecurity, they talked about a number of things. But she said one thing that preyed on her mind, and she definitely said, I wanted to make sure that this was part of the conversation. She said, I had always believed that the nightmare scenario was a pandemic. And so she presented to them the possibility of exactly what we are seeing today, which is an unknown virus for which there is no vaccine and no known treatment that suddenly hits somewhere, and that in a globalized world where travel patterns are as we, had come to accept them, that this could spread quickly around the world, and to then think about how you respond. And as she said to me, it's not as though we gave them, the keys to how you solve all of this, but it was an effort to put that on the table. And lots of important people were there. But a couple of things are notable about the Trump administration. One is that they did not conduct a transition in a very effective way. On the day or two after the election, they fired the transition director. It was Governor Chris Christie, who had been put in charge of preparing a transition plan, and he had binders after binders of recommendations for all kinds of things, including personnel, but a lot of things. He was ousted, and the transition was chaotic from that point forward. And so staffing the government became something that was completely inefficient. And as a result, we've seen that to this very day. As we know, there are many, many very important vacancies throughout the government that have not been filled. Part of this is indifference to it. Part of this is obviously the president's hostility to the bureaucracy, his belief that it is a deep swamp, that it's a deep state, and that people are against him. And so there's been no effort to do that. But the other is that there's been turnover in this administration, particularly at senior levels, just constant turnover of very important people. So you can have all of these plans, but if the people who are the ultimate decision makers and the people who set things in motion don't have any historical knowledge or historical memory, it makes it almost impossible for them to move quickly and efficiently when something like this happens.
Arent, as Dan's been taking us through his reporting about just how administrations over time have sort of dealt with crises, we've also been looking at the information that the Trump administration has had on hand and what it's chosen to do with that. And your latest piece, Arent, looks at this revelation that Peter Navarro, the president's top trade advisor, warned back in late January that 500,000 Americans could die from coronavirus. And then, just less than a month later, he was warning of possibly even more deaths. So there was a conversation happening within the Trump administration about preparing for a serious crisis.
Right. And I think, as Dan's been talking about, it's, these situations are unpredictable. You can't always be prepared for everything. Mistakes are bound to happen. But what we're seeing is a picture that's filling out of increasing warning signs that were in place as early as 2 months before the president really began talking about this in a serious matter in mid-March. Peter Navarro issued one memo on January 29th that warned about the potential of a pandemic. He said there could be 500,000 American deaths or more. I think it's important to put that in context. Peter Navarro is a China hawk and is the most authoritative voice on that issue in the administration. So really, this was a way for him to argue for kind of his anti-China measures. But it did include these very kind of dire projections about what might happen. February 23rd was the second memo that had even increased numbers, talking about 100 million Americans being infected, possibly 1 to 2 million deaths. If you layer this up on top of what we've seen reported by our Washington Post team in a couple of reports, one was about the intelligence community basically warning the president about these things during his daily briefings as early as January. Another was our big story this weekend that kind of ran through all of the series of warning signs that there were. And then you overlay on top of that how the president continued to talk about these things, even as these very serious warnings were coming to his attention, or at least were circulating in the administration. It becomes even clearer that he was kind of in a see no evil kind of mode on this. He was being optimistic in a way that people around him simply weren't. And it wasn't just the health officials. It was people like Peter Navarro, who is a trade expert, not a health official. So I think if you look at the entirety of the timeline, it is just filling out on a daily basis with more warning signs, people who are close to the president who were saying these things, and we're just not finding a terribly receptive audience in the commander-in-chief.
Dan, you talked about turnover, and we've been talking about sort of the revolving door of this White House. We do have news to report. The Washington Post is now reporting that the acting Navy secretary has resigned. This comes in the wake of this real upset. He went to the USS Theodore Roosevelt, that aircraft carrier, and was just railing about the captain who had been forced to resign, who was concerned about the safety of his crew. So we're seeing yet more turnover in the Trump administration. Final thoughts from you, Dan, before we let you go?
Well, I mean, this was inevitable, I think, after the performance that he put on when he upbraided the captain of the ship, who had, by all accounts, tried to protect his ship and crew. And the diatribe that was leveled at him by the acting Navy secretary was something that I think inevitably was going to cause him to lose his job, whether he got fired or quote unquote resigned. So, but I mean, this is the kind of thing that it's the last kind of thing you want in the middle of something like we're going through. I mean, you want government to be operating all pulling in the same direction. You don't want people fighting among themselves. Obviously, there are going to be disagreements about this policy or that policy. Those are understandable. But for the kinds of things that we've seen, it is only compounded the image of an administration that is still struggling and struggling unsuccessfully to get its arms around how to handle this and how to convey that they have the knowledge and the plan to get it done.
All right, Dan Valtz, Chief Correspondent, thank you so much for your reporting. Aaron, you were writing last night about the president's briefing yesterday and his coronavirus team briefing from the White House yesterday. We did get a sense as we heard the president talk, he was asked questions about what was going on with the acting Navy secretary, that he might intervene and he might get involved. What else is standing out to you from the president's message in the last 24 hours and what he's trying to communicate?
So another interesting thing from the press briefing yesterday that I think we can connect to now the resignation of the acting Navy secretary is what's happening with inspector generals in the Trump administration. Dan alluded to the idea of internal dissent kind of not being appreciated. In recent days, we've of course seen the president first on Friday remove the intelligence community inspector general who had forwarded the whistleblower complaint that eventually led to his impeachment in the House. And then today, we've also seen the president remove the inspector general who was going to oversee this $2 trillion coronavirus stimulus package. And then yesterday, there was also some inspector general news where the president was asked about a report that had been put out by the inspector general for the Health and Human Services Department, in which she reported that hospitals had been telling her that there was still severe shortages of PPE. There still wasn't enough testing for them. And basically the president suggested that this person was some kind of a political activist who was trying to take him down. The combination of those three things and then also what we saw with the USS Theodore Roosevelt, I think points in the direction of an administration that's increasingly worried about internal dissent, increasingly willing to take pretty drastic steps that you may not be able to take apart from going through a pandemic. And I think that, if we weren't going through what we're going through with the coronavirus right now, this inspector general situation would be a really big deal. And I think as we move forward, it might continue to be a very big deal.
Let's talk about inspectors general real quick and just why they're sort of an essential part of government and why they're part of the structure that we have.
Right. So basically, inspectors general are appointed by presidents, but many of them are holdovers from past administrations. Their position is that they are supposed to be providing oversight, independent oversight, within each of these government organizations. So when the Health and Human Services Inspector General, issues a report, that's supposed to be something of a real warning sign from inside the administration. The president now is signaling that he has very little tolerance for those voices speaking out against his administration in really any way. So I think that's a very big deal that we're seeing this really materialize and snowball in recent days.
Something else that's happened in the last 24 hours, Anthony Fauci, who's sort of the top infectious disease expert in the nation, downplayed this idea of getting back to normal, because we're still seeing, once again, a push by President Trump to want things to go back to normal. And wouldn't we all love things to go back to normal? But Anthony Fauci is trying to pump the brakes on that a little bit and give a reality check on just what that will mean. So Arent, how is he walking a line and explaining this to the American public?
Well, I think that the president certainly has offered a more significant, tone as far as how serious this threat is over the past 3 weeks. But we've also seen him at times intersperse downplaying the threat. We also saw yesterday, notably, he was talking about how the numbers that he's seeing in other countries and the fact that we have the most cases in the world right now, he thought that other countries were somehow undercounting, that they were having testing problems. And he said that if they were testing at the same rates we are, they would actually have more cases than we do right now. There's very little evidence for that. The testing problems in this country have been more significant than we've seen elsewhere. But I think it goes back to the fact that the president's continuing focus in this is to try and kind of shift blame, to downplay the actual severity of the crisis that we're seeing in the United States. And it really, I think, brings up questions about how much he truly appreciates the threat, at least relative to some of these health officials.
I'm curious on your thoughts on responsibility and sort of where the buck stops, because we saw the Florida governor sort of wavering and not issuing sort of a general order for stay at home within the state, and sort of signaling to the White House and saying, like, well, if the president tells us, and sort of looking to the White House to give him the reason to shut Florida down. But then we're also seeing the president sort of go to Dr. Fauci. And when the president's been asked about some of the state governors who are not shutting their states down, the president's turning to Dr. Fauci and saying, well, if he said that, I'd be inclined to call up those governors and have that conversation.
Right. This has been a kind of an intractable issue over the last 5 to 6 days or so. There are a handful of states that still have not enacted stay-at-home orders. I think it's down to about 8 now. Last week, when Dr. Fauci was asked about this, he said basically, I don't know why we're not doing this. This is something that everybody should be doing at this point. But the president and Vice President Pence have signaled in these briefings that the president believes this is an issue for the states to decide. The president has not been willing to, there is a question about whether he could do a national mandate. There are issues about state rights there, but he could certainly lean on some of these governors, make requests. All of these holdouts are Republican governors, generally in the middle of the country where there aren't as many cases. And so the president could essentially request that they do this thing that Dr. Fauci is talking about. And I thought it was really interesting yesterday. The president said he would do that if Dr. Fauci wanted him to, but then Dr. Fauci came up and kind of downplayed the whole thing. We've seen this over the course of this outbreak, that Dr. Fauci will say things that contradict the president or suggest unhappiness, but then kind of reel them back in when it looks like there's some real tension there. And he said that basically some of these states like Nebraska and Iowa that don't have statewide stay-at-home orders, at least they're doing things that are almost up to that point. He says they are effectively having very similar policies, either because this is what local areas are doing or because there are precautions being taken by the people in those states. So something to continue to watch for, especially as the cases in some of these states increase. But certainly, as we've seen with states that have held out, like Florida, like Georgia, eventually this oftentimes seems to be only a matter of time where the circumstances force these governors to take that action rather than the president asking them.
Arent, so much of this past hour has been about accountability and a timeline of things. And you were reporting on a key part of the American conversation, and that's Fox News and the downplaying that Fox News, and especially its entertainers, it's people who are in the opinion side of things, we're downplaying coronavirus, comparing it to the flu, so chafing at any state reaction, and pushing this narrative that there was nothing to worry about. why is it significant? Why is it worth your reporting time to go back and look at that timeline to see what Fox News was saying?
Right. So this has been obviously a focus of some of the kind of looking back on coronavirus for a while. There's been the president's comments downplaying it, and then there's been maybe many of his supporters in the media, especially at Fox News, who really echoed that message in certain ways. So that's been established for a while. What we've seen over the past week or so, and especially in recent days, is that there's starting to be some pushback. Defenders of Fox and of the president are basically arguing that it wasn't just Fox doing this, it wasn't just the president doing this, but that there were also outlets like CNN who were at times downplaying the threat. The one thing I found when I look back at the commentary that they were citing is that much of it was from much earlier than we saw the president backing off this. It was much earlier than when we saw in early March when Hannity and when some of these Fox personalities were still downplaying this, calling it some kind of a hoax intended to take the president down. There were skeptical voices early on. Many of them were in early February and even January. Dr. Fauci at some point in January said that he didn't think this was a threat at that point. Of course, that was the same day that we saw our first case. So this was something that really hadn't arrived on our shores. So I think it's important to place this in context and look at the time in which people were being skeptical and offering assurances about how prepared the country was. And this is something that persisted much more in the president's comments and on Fox News than it did really in any other outlets or even among the president's internal advisors.
You point out that Dr. Drew Pinsky, who's on television, has apologized for his comments that went very late into this process of education and informing and downplaying it. So we are seeing some apologies, as well as from members of Congress who also downplayed it.
Right, and I think the Dr. Drew example is telling. The thing about punditry is that it's not always a great thing in times of a medical crisis. Pundits tend to be rewarded for being very definitive about things and making predictions. But that's not what you really need when you're talking about medical situations. You want people to be circumspect. You want them to be dealing in the evidence as we know it. What we've seen with a lot of these medical pundits, both on Fox News and with Dr. Drew, is that a lot of them were being very predictive about this. Dr. Drew was asked about if there could be 20,000 deaths, and he said, there's no way that's going to happen. Other pundits said this was going to be no worse than the flu. This is just, when you have a series of unknowns, when you have a brand new virus that we haven't seen before, making those kinds of predictions can land you in hot water. And people relying upon those predictions to address the virus in their own lives can be very dangerous. And so I think in certain ways, it's good that we're having this kind of reckoning about pundits and about politicians making predictions about these things. And I would expect that, people like Dr. Drew are going to be, thinking about how they approach these things moving forward. The question is whether we're seeing any similar reflection from other people who really downplayed this from the very beginning.
And we do have to point out that sort of the sharing of information that's not proven and factual is still happening, that there's, as we were talking about earlier in the hour, this question of drug treatments and the president and some of his supporters on Fox News and elsewhere promoting drug treatments that health workers are saying it's too soon to promote. And once again, we're seeing that dichotomy, Aaron, of sort of fact-based information sharing and then speculation.
Yeah, and I think that's the transition that we've seen, especially on Fox News. Before it was downplaying and alleging kind of a political effort to take down the president. In recent weeks, it has been much more focused on playing up the promise of some of these treatments. This, of course, has also been very much in line with what the president has been saying, but has also been, of course, just like the downplaying earlier, has been kind of opposed to what health officials like Dr. Fauci are saying. I think it's really important to note that there's a chance that these drug treatments do work. There is a chance that ultimately they are going to prove very beneficial. But it is worth pointing out the tension between what we're seeing of people promoting these treatments and what we're seeing from doctors like Fauci, who are saying essentially this is unproven, there can be side effects. Oh, and by the way, if we start using this extensively for an unproven treatment, there are going to be people who need it for proven treatments who may not be getting access to the drug that they need. And so noting all of those things does not change the fact that we're all hopeful that these things are eventually going to work and that they're going to be proven to be successful. There is a reason health officials are circumspect about these things, though, and that's what I think needs to be reinforced.
Arent, thank you so much for all your reporting. And an important note to end on, that journalists are patriots too, and we want to get out of this situation as much as everyone else, of course, which seems like stating the obvious, but sometimes it feels like we need to say that too. So
it does.
Arent, thank you. Thanks to your family for sparing you for this time. Really appreciate it. And thank you so much to everyone who's been watching this special report from the Washington Post. I'm Libby Casey. We'll be back again on Thursday afternoon, 3 o'clock Eastern time, with more reporting from the Washington Post. And you can go ahead and subscribe if you're watching on YouTube. Hit the subscribe button so you'll get informed of programming that we're doing. And you can also, of course, subscribe to the Washington Post generally and support the journalism that you see here today. Thanks so much.